Welcome back, everyone. Let's be honest. I think we all have some questions about the COVID-19 vaccine, so we thought this would be a perfect time to bring in an expert to Great Day to answer some of those questions for us. I want you to please welcome Dr. Hillary Babcock to Great Day. She's an infectious disease physician at Barnes-Jewish Hospital. Dr. Babcock, how are you?
Good. Happy to be here.
Thank you. Happy New Year to you. I know your time is precious, so I'll jump right to it. Let's start with this. Is there anyone who you think should not get the vaccine, and if so, why?
So the only people that are recommended not to get the vaccine are people who have had a severe allergic reaction to this vaccine or to a component of the vaccine. And these vaccines are made in a different way than many of our current vaccines. So they don't have a lot of the ingredients that people may have reacted to in other vaccines. They don't have eggs like a flu vaccine might. They don't have antibiotics. They don't have preservatives. So there's not a lot for people to react to. But if you have had a severe reaction to any ingredient that is in the vaccine, then you should not get these vaccines. But everyone else should go ahead and plan to get the vaccine when it is available to them.
Throughout this entire process, Doctor, there's been kind of this undercurrent of, wow, isn't it amazing how quickly this process has happened? We hear that this vaccine was developed more quickly than any other in human history. But that leads some to be a little concerned, maybe a little trepidatious that it was rushed. How do you respond to people that have those concerns?
Sure. I think it's a great question to ask, and I'm happy to be able to provide reassuring answers. The reasons that this vaccine was able to be developed so quickly, there are a couple of different reasons. One is that work had actually already been going on for developing vaccines against other kinds of coronaviruses for decades. So from the first SARS outbreak, the Middle East Respiratory Syndrome virus, or MERS, both of those viruses luckily don't spread as quickly and sort of died out more on their own. But a lot of work was done to develop vaccines at that time that really helped to set the stage for being able to get this vaccine out more quickly. Also, all of the steps that every vaccine has to go through were done in the same way that they are in other vaccine trials. These were able to go faster because they did several of the steps at the same time. And that was really able to be done due to the federal funding that was put out to support companies so that they didn't have to wait and be sure that everything went perfectly on each step. They could do several steps simultaneously to get things through quicker. But the same requirements for safety testing, for efficacy testing were all in place. So no corners were cut on any of those very important safety and efficacy measures. They were just able to do things in parallel instead of sequentially. Sure. And get things done much more quickly.
Streamlining the process in a way that never really had been done before. Doctor, one of the more recent headlines surrounding COVID-19 was obviously first in Britain and now at least one confirmed case, if not more, in the United States, a new strain of COVID-19. What do we know about the vaccine's effectiveness on that new strain, or do we know? Is it just too early to say?
So it's a little early, but what we know so far doesn't make us think that the vaccine won't work. So that was sort of a triple negative, but we think that the vaccine will also work against this newer strain. It does have some mutations, some changes in the genetic code of the new strain, but not in places that looks like it would affect the way the vaccines work. So as of now, we anticipate that these vaccines will still be effective in preventing spread of the new strain. Also, just want to point out that the other measures that we're all doing to keep ourselves safe also work against this new strain and against any strain. So masks still work, social distancing still works, washing our hands and minimizing contact with sick people and not going out in large crowds of people, all of those things still work for any strain of the virus.
Dr. Babcock, thank you so much for your time. It is a tremendous indication of a trend in the positive direction that people are already walking around with this vaccine inside their system. It's remarkable. We're going to post this segment on our website, KMOV.com/greatday, immediately following the show.